All right.
Ooh, good echo.
Hello.
I think we all
Am
have
I
an echo.
on? Yeah.
Yeah,
I
I
like
just messed everything up.
Chris Mack. What's up, Chris Mack?
Okay, try it now.
Check.
Chris
Hello?
Primer, thanks for the $5.
Hello.
Hello. That's exactly what he said. We'll do it on the real show here in a minute. Well, at the end. Okay, yeah. All the super chats go. We'll do all those at the very end of the show. Thank you.
I don't see a five. Okay. I got it.
Right above
I've
Chris
got,
Mack.
I got it now. Okay, I got it now.
And then there is a question from Chris Mack.
Gotcha. All right, now hang on.
And remember, you were going to try to pin him.
That's exactly what I was going to say. Give me 30 seconds.
Okay.
Let me see if I can.
I think if you just right-click, you can pin it. Or you
Okay.
can, let me see. Okay, those three dots at the upper right-hand corner of Chris Mack's.
Yep.
I think you can just pin it and see if that works.
Give me 30
That way you can pin anything
Right.
you want to say, talk about later.
So it gives me. Now hang on, Steve, because it gives me report. The only options
I
I've
have
got.
channel activity, go to channel, pin message, report.
Okay, see, I
remove.
don't have pin message.
Oh, okay.
That's the problem. See, I'm sorry. I just
Yeah.
that's what I can't do. That's the only one I don't have.
Oh, so if I pin it, do you see what it does?
Try pinning it. See what it
I
does.
did.
See, I did.
Do you see it at the very top of the chat? Just scroll up to the top of the chat.
the very top? Okay, hang
Very
on.
top. You should see.
Oh, okay, yeah. Okay, yeah. Okay, now I can see that.
Okay.
It's
so,
in black.
Okay, it's
No, now I can see that.
okay.
Yeah, maybe if you
Maybe I
pin
could
it-
run through it at the very end of the
Yeah.
show
Yep,
before we
yep.
start the second module.
Yeah, because now I
And
can-
I'll just pin the ones that we want to do.
right on.
Okay, yeah,
Right.
we'll do that.
Yeah,
That'll
yeah.
work. It won't. We I can't pin the super chats.
Right.
But we don't get that many of those
Okay.
anyway. Thank you, Chris.
All
You're
right,
an
Chris.
anomaly.
We got you. We got you.
All right, you ready?
Club and yeah.
All right. I believe we're ready after all the technical issues this morning that I had. And we got a bunch of questions, and Tacey's got a good topic time, so let's get started. And the AI is working decent, but it took me 2 hours to do it, so I'm going to do it a different way, much easier this time, but we can still use the air conditioner.
Yay.
The audio just stinks for everybody else listening. All right. And I'll see if there's like an AI filter that I can put between the mixing board and the feed that would quiet that. And if there is, that would be awesome. So I'll work on that.
Cool.
All right, here we go.
Ooh.
Too loud? It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve, with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my wife, Tacey, my partner in all things. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POO-HEAD. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Everything going okay over there, Dr. Scott?
Oh yeah, fresh batch of nasal sprays. coming
Okay,
in.
and you got a bunch of tchotchkes you can send out to people.
Lots of great
If you-
tchotchkes.
Not an ad, but if you order from Dr. Scott's website and you say you're a Weird Medicine listener, he will send you some stupid weird medicine.
Some good
work.
stuff,
And
that's
it's
right.
it's mostly stupid.
Great.
I mean, who needs a coaster with my dumb face on it?
It's a cool coaster, though.
It is.
And keychains, too, of course.
Yep, that's right. Of course, we have keychains. Weirdly, you order keychains, and they show up a week later. That's weird. Okay, I don't know. Some people may understand what I'm talking about. All right, check and also check me out on Normal World. Periodically, we're doing this week. I think it is why certain people's flatus smells and others do not. And I found some interesting graphics for that one. And then next week, we're going to bust the myth of female ejaculation once and for all. If you want to read up on it, go to our website at drsteve.com and just search for female ejaculation. You will see the truth. But I don't want to spoil it. But it's not just piss. Okay, that's the spoiler. All right, I did spoil it anyway. But what it is very interesting. Okay. All right. Yeah, you got anything, Scott?
No, sir.
All right, let's get right into Tacey's Time of Topics.
It's Tacey's Time of Topics, a time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
Hello.
Hello.
Today we're going to talk about penis disorders.
Yay.
Uh-oh.
I feel like we've talked about penis disorders many times.
Well-
but since it seems to be the favorite topic
talk
of
about
the
it.
listeners,
You can't talk about it too much. Now, that could go both ways. That means you should not talk about it too much, or it's impossible to talk about it too much.
Yeah.
It's like you can't put too much water in a nuclear reactor. It's like, what do I do? Do I put more in, or do I not put more in? Anyway, all right, go ahead.
so we are going to go over disorders for the 120th time.
Okay, very good.
Balanitis. It's swelling, redness, and infection of the head of the penis, mostly seen in uncircumcised men.
Oh,
And
here we
that-
go. Now, that's Tacey saying that.
It's-
The intactivists out there are going to come after me again. Thanks, Tacey.
I said it and I meant it.
Okay.
Hypersensitivity to products, STIs, diabetes, and poor hygiene are the causes. Many of these causes of these disorders is poor hygiene. So
I was just going to say that.
clean that pecker.
There is a common thread in almost all of these.
Cleanliness.
Treatment, appropriate antibiotics or antifungals. Good
Okay.
sugar control if you're a diabetic. Circumcision may be suggested if it's severe.
Yeah, if they're uncircumcised and they have balanitis that they can't resolve, which is, it's redness, swelling, pain,
Oof.
and
Oof.
exudate
Ugh.
of the head, the glands of the penis.
And of course, good hygiene can help prevent recurrence.
Correct.
Second one, phimosis. Did I say that right?
Yes, you did. Oh,
Okay.
well, okay. Well, I'm not on that screen.
Thyself
Oh, I knew it. Damn it.
Well, she was asking for it.
That is true.
I didn't ask for shit. That's a
Subtle.
tight
Now what
foreskin
now?
of the penis.
I don't remember asking you a goddamn thing.
It's because I didn't. The causes of birth defect, infection, scar tissue, poor hygiene.
Now, what is phimosis? You're talking about phimosis again?
Yes, tight
Okay.
foreskin of the penis.
Right, that's also known as Sam Roberts disease.
Yes.
Right.
And it requires immediate medical attention. And that includes gentle stretching over time, steroid ointments, separating the foreskin, or, of course, circumcision.
Yay. That's why I don't
Disorder
get in trouble
number
with the
3.
intactivist. Anyway, go ahead.
Paraphimosis.
Correct.
The foreskin, once retracted, gets stuck behind the head and cannot return.
That's right. If you ever peel your foreskin back, or if you are like a CNA and you're peeling the foreskin back on someone to insert a Foley catheter because they can't do it themselves, make sure you always unretract the foreskin.
Yes.
Because if you don't, what's going to happen? The head of the penis is going to slough off.
That's terrible.
Now, this can occur after an erection during sexual activity. The treatment is to apply ice or pressure to the glands to reduce swelling, medications to drain the penis, or circumcision in severe cases. If not treated immediately, it can lead to serious complications such as gangrene and may require amputation.
That's terrible.
Okay. Priapism. Did I say that right?
No.
Priapism.
There you go.
There you
Very
go.
good.
A persistent, often painful erection that does not go away or last more than 4 hours.
Yeah, in Greek mythology, Priapus is a minor rustic fertility god, protector of livestock, fruit plants, gardens, and male genitalia. He's marked by his oversized, permanent erection.
Oh, my.
Yeah.
Okay.
Gave rise to the medical term.
It can be caused
Yeah.
by drug abuse, certain medications, spine disorders, injury to the groin, anesthesia, blood diseases. If not rigid or painful, may require urgent treatment. Ischemic priapism requires immediate treatment to avoid permanent damage. So
Yeah,
you can treat it
Go ahead.
by draining blood from the penis, medications to shrink blood vessels, surgery, or blood transfusion.
Yeah, there are medications like Sudafed.
Okay.
If you've ever taken Sudafed and tried to have intercourse, you can see why they use it to relieve priapism.
Yes.
Because it's impossible. And it constricts the arteries going into the penis, so there's less blood flow, and it resolves it. Priapism kind of sucks. If you just have an erection that won't go away, and if you bust a nut and it goes away, then you don't have to worry about it. But if you start having pain or it's turning blue, that is a medical emergency. And again, you have to have it taken care of because you don't want your penis to slough off.
Is there a real thing, saltpeter, that was used for?
Yeah, saltpeter wasn't that like
Like what,
magnesium sulfate or
some
something?
kind of medicine they used to give, I thought, for priapism.
Well, we used to I went to
I don't know why I thought
a
of that.
boys' boarding school for a while in high school, and it's potassium nitrate,
Okay.
and that is saltpeter, and so we were informed that they were putting saltpeter in our food to keep us from being, horny.
Overly horny.
Yeah. And I'm looking just to see
I
if
wonder if
there's
it actually
actually
works.
anything. I doubt it. I think that was just like Spanish fly is a myth.
Got on. Has no effect on carnal. Okay, here we go.
Okay, you found it.
McGill University says there is no effect on carnal urges. So there you go.
Okay, good.
Moving right along.
Thank goodness.
Yeah.
Yes.
Peyronie's disease.
Oh, here we go.
Oh.
Sorry. In folklore, potassium nitrate was once thought to induce impotence, still rumored to be in institutional food as an anaphrodisiac. That's a good one.
Aphrodisiac.
Anaphrodisiac, right. So if you put the Greek "an" in front of it, means not, so it's not an aphrodisiac.
Ugh.
No scientific evidence for such properties.
Gotcha.
So there you go.
Whew,
Okay.
thank goodness.
Phew.
So Peyronie's is bending of the penis during an erection.
Correct.
So it doesn't require treatment unless a man wants to have penetrative sex.
Yeah, well, okay.
So
I guess I don't have to get it treated.
that's right. Non-surgical treatment options include injecting medications into the plaque to soften tissue and correct bending.
Right.
Surgical treatment options include removing the plaque and placing new tissues, or removing or pinching the side tissues of the penis to straighten the penis. Penile implants may be required for achieving or maintaining normal erections.
That's a last resort. But, the new elastase injections are much better than the old verapamil injections. That's actually an enzyme that can help to loosen up or a scar, because scar tissue is not elastic, but the sheath of the penis has a certain amount of elasticity to it. And when you have an inelastic scar on one side of the penis because somebody folded their semi-erect penis over during vigorous intercourse and kind of missed, and these things happen, then when the erection occurs, the normal side will inflate normally, but the other side will not be able to because of the scar, and so it will curve toward the side of the scar. And it can be severe. Sometimes it can be so severe that it's painful for the person to get an erection.
Yes.
Okay.
And those are the ones that need to get fixed.
Yuck.
All right, what else you got?
Erectile dysfunction,
Okay.
anxiety, stress, depression, certain medications, diabetes, heart disease, medication side effects, alcohol use, surgery, unhealthy habits, lack of exercise.
Okay. Smoking.
Smoking.
I think, was
Did it say
smoking on
smoking
there?
in there?
I think so.
It didn't say so.
I didn't think
Okay,
so. Yeah.
smoking's the number
Smoking, yeah.
one cause the number one reversible cause of erectile dysfunction in men over 40. And that's what made me quit smoking. The cancer, that was too abstract. Heart disease. I had dissected aortas of people in medical school that had smoked and had these big, giant, chunky plaques. I mean, their
gotcha.
aortas were just hard and crunchy. And that didn't scare me. But as soon as I learned that men over 40, statistic with smoking, it was like, yep, I'm putting these fuckers down.
Yep. I think I told you too. The reason I quit chewing Copenhagen and dipping, or chewing tobacco and dipping Copenhagen was because it wasn't from the mouth cancer, my teeth falling out. It was because I was afraid if something happened to my face, I wouldn't get another pretty girl in my life.
Well, there you go. That's another thing.
You had to stop chewing tobacco.
Particularly
pretty
back
quickly.
then when you got oral cancer, they would
Yep.
just dissect your face away.
No,
they
it's
don't
terrible.
do that as much as they did before. But
Yeah, my dentist told me I was starting to get some elephant skin in my mouth. Elephant-like skin. I thought, well, shit, that's got to be bad.
yeah,
It's not
Yeah,
good.
so I quit.
yeah, leukoplakia it may have been, which is, changes of the squamous cells in the mouth. Did I ever tell this story? I don't want to do it now, but I ever tell the story about my ENT professor that was showing us the slides of people with their faces dissected off?
I don't think so.
I need to
No, I
tell
don't
that
ever
story.
think- no.
I don't want to interrupt Tacey's thing. Remind me someday to tell that story because I have to mask the person's name
Okay.
because it would refer. They're still in practice, but it was one of my colleagues in medical school. But anyway, go ahead, Tacey. It's a little teaser for the future.
Okay, so for erectile dysfunction, you can take oral meds, Kegel exercises, penile implants, penis pumps, and testosterone therapy.
Okay, very good.
Gotcha.
If you have low testosterone.
One last thing,
Okay.
penile cancer.
Oh.
Penile cancer.
Ugh. You went from bad to worse.
Not having a cause can be not having been circumcised, HPV infection, smoking, phimosis, unhealthy habits, psoriasis treatment medications, constant exposure to ultraviolet light, and being over 50.
Yeah, so being a nudist is what they're saying. Don't,
I guess
be
so.
careful. Wait,
Right.
severe
makes sense, though,
sunburns on
To
the skin
anything, to
can
anything,
lead to cancer down the road.
And that's
So-
sensitive skin, too.
Yeah. So if you're running around, if you fall asleep on the beach, on a nude beach, and you get your junk burnt,
What's the problem?
it'll heal, but it does put you at risk for cancer down the road.
Yep.
So, treatment is surgery to remove the cancer using wide local excisions, removing only the foreskin using a microscope, or laser surgery. In some cases, the entire penis or part of the penis may need to be removed along with the lymph glands. Radiation and chemotherapy may also be used.
Yeah. So HPV is the particularly preventable one. Kids under 12 are recommended that they get the HPV vaccine. It only vaccinates against the cancer cancer-causing strains. And cancer-causing strains, particularly HPV strain 16, can cause head and neck cancer, obviously oral cancer or tonsillar cancer, rectal cancer, penile cancer, cervical cancer. And getting the vaccine, the Gardasil vaccine, can prevent that. We're already seeing a decline in abnormal pap smears in girls that had it, when they were 12.
And that's not been around for...
No, it's not been around that long. That's one of the things that people were saying is, listen, we don't have long-term data. How do you get long-term data? You got to have people that try it. Yeah. And so we're seeing good results from it.
Cool.
And very good. You can still get genital warts, but it'll help prevent the ones that are the really dangerous ones. So that's cool.
Good.
All right. That it, Tace?
That's it.
All right.
Nice
well, thank you very much.
Very important topic.
Until next time.
Very important.
Until next time. We'll do equal time. We'll do vaginal disorders next time.
There you go.
All right.
Sounds good.
Right.
Okay. Thank you.
Number one thing, don't take advice from some asshole on the radio.
Ooh, let me get my clock out.
Oh, all right.
Okay. Actually, we're not going to use the clock this time because I did a deep dive on a couple of these, and I want to go through it all.
You want to start with the...
You know what? That is so unfair and not fun.
Listen, you'll do Chris's first from the fluid family?
Okay, yeah, if you want to do
all
that.
Right, start
okay.
the timer.
Okay.
Okay. Hold on.
All right, Dr. Steve. We do have a good question from the fluid family here. Chris Mack. Hey, Dr. Steve. Will grapefruit juice negatively affect Clomid absorption? I know it can potentiate some medications and nullify others. Not sure where Clomid falls in this kind of category. So
okay. Well, sometimes they will use Clomid with this drug called bexarotene, and that one, food helps with the absorption, and grapefruit juice during treatment can increase the blood levels of that bexarotene, but that's not the problem. I do not believe that Clomid is affected by that.
Yeah, I couldn't find it.
So, I'm looking Clomid. I don't see anything. I see a whole bunch of tyrosine inhibitors that it interacts with, but I don't see anything about grapefruit juice.
Yeah, I couldn't. Yeah.
Grapefruit juice is weird. It's an inhibitor of this cytochrome P450 system that a lot of drugs are metabolized through.
Okay.
And it will cause some great difficulties if you take it in, regularly. You think, grapefruit juice is good for you. It's citrus and all that stuff.
Good in vodka.
It is.
Good
and
point. You got a good point.
People who are taking things like statins that drink a lot of grapefruit juice, and particularly in vodka, can get a double whammy to their liver.
Oh, wow.
So, go easy on the grapefruit juice if you're on medication. At least find out which medications are a problem.
Check them all out.
Thanks, Chris Mack. And
Thanks, Chris.
I will look into that further and just make sure that I'm not missing something, okay?
Yep.
All right.
Cool.
Oh, 1 minute and 18 seconds left.
All right. No, timer's off for this next one.
Okay. Yeah, I've just found something else on clomiphene, but no, we're good. Okay. All right. Here we go.
All right. Hello, fluid family.
Uh-oh.
Anyway, I'm going to touch base with you real quick. Been seeing more and more about, do apples affect diabetes and blood sugar levels? Most of it is saying about how the sugar of apples doesn't really affect your blood sugar, but fuck it, let me try this goddamn call again.
What? Okay, all right.
All righty
Hello,
then.
fluid
two.
family, and you all sitting in the studio. Quick question for you. Been seeing more and more stuff about, do apples affect diabetes and blood sugar levels, and how apples might actually be used to help reduce diabetes effects. Have you heard anything about this? Bye!
I have. Oh, so yeah, that was so much better the second time. I think your first one was fine, dude. So apples and diabetes. I've become one of those people now that I realize that my medication was killing me. I was talking about this on a show the other day where, half of the things that I'm taking now are supplement. Well, actually more than half. You and I were already taking the anti-aging supplements like
phosphatidylserine.
Yeah, phosphatidylserine and
taurine.
Riboside nucleotide. I can't take the taurine. It makes me crazy.
Oh, does it? Yeah, I like it. Yeah.
I tried it, and that was a huge mistake. But you can get taurine in other things. So I am very interested in these things. I take beetroot for my blood pressure. My blood pressure is doing fine. I'm not saying anyone else should do any of these things. I'm just saying I have to do it because I'm for whatever reason, I'm sensitive to the standard allopathic medications. So I was interested when Stacy called about this apples and diabetes thing, and it turns out that there are these molecules in other fruits, but also in apples in pretty large quantities called polyphenols. Okay. And these polyphenols can actually reduce insulin resistance, which is the problem in type 2 diabetes. So I found here's current topics in medicinal chemistry. Bioactive compounds are effective against type 2 diabetes mellitus, systematic review. And what they found was there are all these polyphenols and antioxidants like quercetin, rosmarinic acid, cyanidin, and other things, rutin. And the major source of these were citrus fruits, grapes, onions, berries, cherries, broccoli, honey, and apples. And then there's green tea, ginkgo biloba, St. John's wort, stuff like that. Cucumber, spinach, even black tea. So there's a whole bunch of things and those are all things we consider to be mostly healthy things to eat, right? Mm-hmm. So after I read this, I did some more research, and I found that apple polyphenols, not other polyphenols, but apple polyphenols, induce browning of white adipose tissue. Now, do you know about white and brown adipose tissue?
I don't think so.
Okay, so we're talking about fat tissue.
Yeah, sure, fat.
White fat is the bad fat.
Okay.
And brown fat is good fat. It actually helps you burn calories. It is thermogenic. In other words, it helps you to keep your body temperature up. And so by doing that, it's burning calories.
Gotcha.
And so apple polyphenols will induce this conversion of white adipose tissue to brown adipose tissue. All right? So I thought that was really interesting. And I do like, and by the way, the number one apple brand that was beneficial in these things, Honeycrisp apples. Thank you.
There you go.
My favorite.
That is your favorite.
Yeah, I've been eating those anyway, so something in my body must have understood that or something. I don't know. I don't think that's what it was. I just like them. I like kind of sour stuff. And then here is fruit consumption and risk of type 2 diabetes. Results from 3 prospective longitudinal cohort studies. So this is one where they didn't go back and look at charts. What they did was they followed people over time at a starting point in the past. They followed them forward. And they had 66,000 women from the Nurses' Health Study, 85,000 women from the Nurses' Health Study 2, and 36,000 men from the Health Professionals Follow-Up Study. They were free from major chronic diseases at baseline. And so what they were looking is there a statistically significant difference in diabetes between the two? And so a greater consumption of specific whole fruits, particularly blueberries, grapes, and apples, was significantly associated with the lower risk of type 2 diabetes. So this, that may be a lifestyle change that you can make if you're at risk for type 2 diabetes. In other words, you've got it in your family or you've got some known insulin resistance. And Tacey won't eat them because they're sour. Mm-hmm. But wouldn't that be great to prevent the oncoming diabetes because your dad had it? And you've had, conditions that make you glucose intolerant.
Yes.
So, it might be something to think about. Ew. Now, apple juice does nothing, and it actually makes it worse. So you have to actually eat the apples. And now, so that's the kind of the polyphenols and stuff. A 2019 review of studies indicated eating apples and pears was linked to a decreased risk of cardiovascular problems and also diabetes mellitus. And, these antioxidants, which we were all excited about in the 80s, and then found out that if you take antioxidant supplements and you smoke, actually makes things worse because you need those oxidants to kill cancer cells when they're forming. And so antioxidants weren't great, but if you don't smoke, antioxidants in your diet can protect your body from certain chronic diseases. And significant amounts of quercetin, chlorogenic acid, and fluorizin, which potentially slows down sugar absorption and lowers blood sugar levels, were found again. Honeycrisp apples.
There you go.
Thank you. All right. So there you go. So that's my deep dive on apples and cancer, Dr. Scott. Go.
May I add to that, too?
Of course.
Just my A1C had climbed up just a teeny bit,
yeah.
And I was just a little concerned, and I kind of did a little bit of research on this, too. And I started two things, believe it or not, and I never told you this, but eating a red apple every day because of the red flesh seems to be better for you. And I take a supplement. Now, this is just me, but there is some research on holy basil.
You started me on that.
I started on holy basil, and the last time we checked, my A1C was below 5.
Wow, I thought the holy basil was for cholesterol, though.
It's for both.
It's for both. Yeah.
Okay. No, it honestly it is. Yeah,
that's interesting.
Astragalus.
It's not quite as great as astragalus, but it's pretty close. But yeah, so my levels of my lipid panels were profoundly lower.
Yeah.
Now this is just me.
Yeah.
But there is some research showing that holy basil or Tulsi Tulsi basil is the other name for holy basil.
Hell is holy basil.
Yeah,
but how's it different than regular basil?
I don't know. Tulsi Tulsi basil is the other way, but it's been shown to lower serum glucose levels and in cholesterol lipid levels. So
wow.
Yeah. Now that's and there. I mean, I'm not saying the studies are perfect, but I mean, heck, if it doesn't hurt you, it's better
holy
than some
basil
of the other
is
shit you can take.
Ocimum tiniflorum, plant native to India.
Mm-hmm.
Commonly used in traditional Indian medicine system Ayurveda. Okay. I'm going to do a
I should take that.
deep dive on
it's
that.
an
Well,
easy take.
you should do it if there's data that shows. I mean, it won't hurt anything.
Yeah.
I don't think,
No.
unless there's drug interactions with it or other toxic effects. We'll do I'll send me an email
me
on
some
that.
of that.
I'm gonna
stuff,
send you I'm gonna
Steve.
send you a thing from PubMed.
Okay.
on it,
All right. Yeah.
I'll
I'm
do
going to
that.
look at that.
I got you.
Yeah, we'll check out holy basil. Well, here's Healthline. We might as well. What the hell? It's a green leafy plant. It's also known as Tulsi, as Scott said. So he gets a.
Give thyself a bell.
Many studies support the use of the entire plant of holy basil for human use and its therapeutic value. Nutritional value is also high. It contains vitamin A and C, calcium, zinc, iron, and chlorophyll. Says, all parts of the holy basil plant act as an adaptogen, which is a natural substance helps your body adapt to stress and promotes mental balance. Well, okay.
There you go.
Yeah,
I need
okay.
more of
There
that.
is some, and as Scott said, there is some
I definitely need to take
data
that.
on this stuff. I've got clinical efficacy and safety of Tulsi in humans, a systematic review of the literature. Now, this is in evidence-based complementary and alternative medicine, but this is a journal that actually looks at the evidence for this stuff, and they found 24 studies. All studies reported favorable clinical outcomes, with no studies reporting any significant adverse effects. But I don't see what kind of studies these were. So if they were, observational or decent studies, a lot of the studies in that literature are not that great. So, we want those clinical trial, double-blind, placebo-controlled studies. And they are hard to fund, because who's going to make $1 million or $1 billion off of selling holy basil?
Yeah.
But it would be nice to have that. So we'll look at that, and I will give you a report next time. Okay, very good. All right.
Good stuff.
Anything else, Dr. Scott? I eat 2 apples a day on my way to work, and then Is this okay when I'm done and I've got the core and I'm in my car to toss the cores out for the deer?
The deer and the ants.
Yeah, I mean,
absolutely. Yes, absolutely.
That's not really littering, right?
I do the same thing. I just kind of wait until I'm going around a curve and nobody's looking at me.
Right,
So
right, me too.
They don't think I'm throwing trash out.
Exactly. I'm worried that they're going to think I'm throwing trash out, but it seems to me
bugs
that
it.
throwing an apple out, apple core out is okay.
Yes, absolutely.
Okay,
Yep.
good. Well, at least I got validation from the
hippie,
from the hippie acupuncturist. All right.
Hey, Dr. Steve.
Hey.
I just have a question that not a lot of people have been able to help me with.
And by the way, this one is from 2015.
Okay, this
Anytime
one
I
is
get in
3
the water,
minutes.
whether it be a pool, a saltwater pool, a chlorinated pool, a saltwater pool, or even the ocean, after I get out, within about 24 hours, I'll get massive rashes on both sets of my thighs, my back, the inside of my elbows, anywhere that kind of any joints or anything like that. I've seen a dermatologist about it. He said he didn't know what it was.
What?
I've
Come
seen other
on.
doctors, and they just tell me to take Benadryl and the such. Is there anything I can do about it?
How do I know what this is and the dermatologist doesn't? That's crazy. Do you know what this is?
Contact dermatologist.
It's called aquagenic urticaria.
Urticaria.
Yeah, but it's aquagenic urticaria. It's a very rare condition, which I can understand maybe the dermatologist hadn't seen it, but they ought to know about it.
Right.
But they get red, itchy rash after exposure to water. There's about 50 cases of the condition reported in the medical literature. So if I saw this person, I would write them up.
Oh, wow.
Because I've done that. When I have something that's extremely rare that I see in my office, I'll write up a case report and a review of the literature so other people will recognize it. Maybe this guy's dermatologist. But anyway, they can, the itching can last 30 minutes to 2 hours, and there are some treatments available. But what happens is skin contact with water causes these itchy things because of release of histamine.
Right.
And it is treatable. Nobody knows why certain people have it. Is it an allergen in the water rather than the water itself, or is the water interacting with something on the skin? Does it happen when he is in the shower, or does it only happen when he's immersed in water? There could be a psychological aspect to it as well. Or maybe you can only get triggered if it's your whole body. So then what I would do is put the person in a bathtub and see if it happens then. Okay. So they do this water challenge test to confirm it, and they just apply a cloth dampened with room temperature water to the skin for 20 minutes. That's why maybe they have to have longer exposure than you would get in the shower to have this happen.
Gotcha.
So anyway, antihistamines are recommended. So I agree with the dermatologist on that. We like the second generation H1 antihistamines. That would be not famotidine. What's the what is
like
Allegra?
Claritin
Yeah.
or-
Oh, that's loperamide. No, it isn't either. Golly, what I'm having a
Allegra.
senior moment right now. Well, anyway, Allegra, Claritin, Zyrtec, those kinds of things. Cetirizine is Zyrtec, right? Anyway, that stuff used to just traipse off of my tongue, and now I'm having a problem remembering it. But anyway, get the second generation antihistamines. If you know you're going in the water, take it. Most of those last 24 hours, or at least 12 hours. So take it a couple hours before you get in the water. If it's localized, you can use topical medication, but it's all over your body. Nope. And there you go. So anyway, and then people will ask, well, how can you shower? Well, you have to be in the water 20 minutes before it happens, then you get out.
Shower quickly.
I forgot about the timer.
Shower quickly.
Yeah, shower quickly. All right. All right.
Hey, Dr. Steve. My name is Brian.
Hey, Brian.
I'm 28 years old, male, about 6'1", 180, relatively healthy, been healthy pretty much my whole life. I got a question about asthma. I've had asthma since I was born, since I can remember. I've had friends that have told me, oh, I've grown out of it. I'm like, oh, well, good for you. I still have it, still the same issues. I mean, I've never really seen any relief from it. Really not that big of a deal. I've taken albuterol inhaler pretty much every day.
Okay.
It's a daily thing. Not that big of a deal. Doesn't affect my life that much. Just kind of embarrassing, when you get done fucking your old lady, you got to roll over and take a couple puffs.
Yeah.
Look like a nerd. But
No.
anyways, so I've read about asthma. I guess I kind of have an understanding of what happens, but I'm kind of curious to know, is there a genetic, factor to that? Is it something that runs, genetically? Is that the reason I got it? None of my siblings have it. My parents don't have it. I have an uncle that has it, but that's it.
Yeah.
And then secondly, is there any treatment for it that doesn't involve albuterol or I know there's Advair, but it's pretty damn expensive. But are there any other alternatives? And I can ask Dr. Scott too, although I tend to think that Chinese medicine, herbal people are kind of full of shit, but I'll give it a shot. So if you got any suggestions, Dr. Scott, that would be great.
Yeah. See, there's no atheist in a foxhole, and so when you're desperate, you go. You'll do about anything, even stuff you think is maybe bullshit. And in my case, I did that, and it turned out pretty well. So, so let's just talk about asthma. About 6.1% of male adults have asthma. This kid, or he had it since he was a kid. It's possible that he had respiratory syncytial virus as an infant. And some of those kids will have asthma their whole life, and there's nothing much you can do about it except treat it. That is RSV. Our kid had it at age 5 days, fever of 105. When we got him to the hospital, I remember the nurses say, if he survives, he's going to have damaged lungs. And we were, what? If he survives? What do you mean, if he survives?
Jeez.
Well, this is bad. So, but he sailed right through. Why? You want to explain why, Tacey? Yes, very good. Thank you. Tacey was breastfeeding, and she gave it to him. She had a cold, because RSV tends to be a cold in adults. And our hypothesis is, because we didn't test for it back then, we do now, that Tacey had it. He got it from her somewhere around, the day of birth, and she had antibodies to it in her breast milk, which are IgA antibodies that are secreted in breast milk, and her feeding him through the, her holy bosom caused him to survive, and not only to survive, but to thrive. And never have any problems with it. He just sailed right through. He was totally fine. So thank you, Tacey, for that one.
You're welcome.
And,
You have
Give
1 minute
thyself a
left.
bell.
Oh, wow.
Well, it's going to take a little bit longer than 3 minutes on this one.
It is asthma. Yeah,
It is asthma.
Yeah.
There are other treatments. If it is mild asthma, he may get by with a leukotriene inhibitor like Singulair. That's possible. There are these long-acting beta agonists where he could just do it once a day. It's like a extended release albuterol. Some pulmonologists will recommend that he take an inhaled steroid to prevent the constriction of his airways, because they feel that down the road that'll prevent him from developing chronic obstructive pulmonary disease. So I would see a pulmonologist for this.
There are new medications out there.
Yes, all kinds of stuff.
Yeah.
And I'm sure he's seen a couple since he's had it since birth.
I hope so.
Yeah, you
but
would
he may be
think,
just seeing his primary. If he's just doing albuterol, though, that's not. There's more out there.
Oh, yeah.
Yeah.
Totally.
And,
may have
and there
been-
are rebates, too.
Correct.
That can cut the cost.
The one I really that worked for me is the Trelegy, but there are others that work really well. I take Breztri, and it is a long-acting beta agonist, something to reduce mucus, and then a steroid. And you go, well, steroids, but if you're inhaling it, it's actually maybe beneficial. So, but just check. It may be that he started albuterol when he was a kid and he just stayed on it all this time, and there's other stuff out there.
Yeah.
All right?
Yeah. And can I say real quickly,
What was that? Go ahead.
Yeah, there is some research on the use of acupuncture for
Really?
Treatment of asthma, yeah. What it does, it helps to calm down the inflammatory response, number one.
Okay.
But the other thing I do.
Okay, go ahead.
Is-
I'm going to just do a PubMed search on that one.
The other thing that I do, because I see it every single day,
Yep.
either asthma or COPD, is by stimulating the muscles, the accessory muscles.
Yes.
Help-
Talk about
help
what
to-
accessory
yeah,
muscles
help to
are because
breathe.
people don't know what that is.
So real quickly, the mechanisms of breath, the diaphragm moves, the muscles in between the ribs move, which would be the accessory muscles, and then the muscles in the neck and shoulders actually help to move the upper part of your ribs. And when they all move together in unison, that helps to create this vacuum that brings in air into the lungs, because the lungs are passive. And if there's inflammation in there, then it makes it all really challenging, or if there's scarring or any kind of disease. So what I can do with the acupuncture needles is stick the needles into the muscles and stimulate those muscles to help them either move normally or to calm down any kind of spasms or
if you're right on the verge and getting something that'll give you a little bit more optimal breathing, I'm in favor of that, and it certainly isn't going to hurt anything.
No,
as long as you're not doing that to the exclusion of
I never said it. I never said no. Yeah, but the other thing I will tell you too, there's some osteopathic manipulations and maneuvers to help the ribs move a little more freely and to help the diaphragm move more freely. So finding a good DO that has some skills and some knowledge about treating asthmatics could be really beneficial, because we employ those guys too.
DOs are physicians who went to osteopathic school rather than allopathic medical school. And they basically these days have exactly the same curriculum, except that they have this, OMT classes, these manipulation classes.
Osteopathic manipulative therapy.
There you go.
So they do a little bit more manipulation. And again, I am not saying at all because the new medications for asthma are really incredible.
Yep.
They really are. But in a conjunction with those, find some other things.
I did find a Cochrane database systematic review. Cochrane is a very highly respected journal and group that looks at data to find evidence-based approaches to medicine by through systematic reviews. In other words, just taking all the literature, putting it together, and seeing what the answer is. Now, I will say that their conclusion with acupuncture and asthma, this is for chronic asthma, not enough evidence to make recommendations about the value of acupuncture and asthma treatment. There were some studies that showed a positive effect, and the ones that didn't show a positive effect, Dr. Scott, the sham acupuncture was actually in places on the arm where they actually treat acupuncture or asthma with real asthma or acupuncture.
Right.
So those studies were pretty invalid, because if they put the needles in the same place that the acupuncturist is, it's not really sham acupuncture at that point.
Not, no.
So anyway,
Yeah.
all right. So that remains to be seen. Try it. If it works, fine.
Sure.
Acupuncturists tend to be cheap, and it's not going to hurt anything. Again, as long as you don't do it to the exclusion of it.
Yeah,
I may be
you're
easy,
cheap.
but I ain't cheap.
Well, inexpensive compared
I'm
to.
easy.
Yeah.
Oh, I know.
But anyway, all right. You know what I
Easy
mean.
and cheap.
You are cheap.
Hi there, calling from Canada.
Hey.
Question. My mom recently found out via ultrasound that she has a moderately fatty liver.
Uh-oh.
She had blood work done that initially showed elevated ferritin and ALT. I think her ferritin was about 517 and her ALT was 43 micrograms. She does take meds for cholesterol, blood pressure meds, and osteoarthritis. And she does drink wine. She drinks probably about 6 to 8 glasses a week, I'd say.
There's a reason why I ran this one today. So.
Shut up.
She's been a bit freaked out about this, so she did decrease her alcohol. I would say she eats fairly healthy.
Yeah.
I was just wondering what else she could do to improve her liver health. Dr. Scott, do you have any natural remedies that you'd suggest?
Absolutely,
Thanks.
he does. So, for a long time, we used to call this non-alcoholic fatty liver disease or alcoholic fatty liver disease. And this is, a range of things that develop when too much fat is stored in the liver cells, and it causes inflammation and damage to the liver.
It's unfair.
And can end up being cirrhosis if it isn't under control. Now, we're not going to call it that anymore. We're calling it steatotic liver disease. because non-alcoholic reference doesn't capture the cause of the disease, and fatty is considered a negative connotation. This is that euphemism treadmill thing that we used to talk about a lot, where things that were medical terms became pejorative terms, like idiot. Idiot was at one time a medical term, Dr. Scott. Dr. Scott, his IQ is 60 or below. He's an idiot. And then people started using that term.
He's a fucking idiot!
And then all of a sudden we can't use it in medicine anymore. And it becomes pejorative, and then we have to change it to something else. Okay, so that's the case when it comes to fatty liver. Now, Tacey, can we speak candidly about your situation?
Yeah, whatever.
Yeah. Fez Watley used to be called fatty pneumonia, and our sort of joke is that now we can call Tacey fatty liver, but it doesn't really work. Fatty pneumonia was funny. Fatty liver just doesn't, people are like, what? So, because it's a real condition, that's the actual name of the condition. But it can be absolutely genetic. Tacey has insulin resistance in her genetics, probably on both sides, but certainly on her father's side. And that can lead to fatty liver. You can have increased alcohol intake. It's called MASLD, in other words.
Which I may or may not do.
Right. And then alcohol-related liver diseases, ALD. And then there's these specific, drug-induced liver injury, liver disease from celiac disease and malnutrition and stuff like that. And then we always have cryptogenic steatotic liver disease, which just means we don't know what the hell caused it. So, some people will get this and it's very severe, and then they get scarring and inflammation, and then they get cirrhosis, and other people just have it, and they just have it. And they'll get mildly elevated liver enzymes. That all that is the liver cells that are being pushed aside by the fat cells die.
Oh, Tom.
And, yeah, but we're talking about you, so we don't have to do 3 minutes on this one. The liver cells that are being pushed aside by the fat cells die, releasing enzymes that are inside the cells into the bloodstream, and you can detect those. So high blood sugar can cause this, or be a risk factor. High levels of fat in the blood, particularly though triglycerides, not so much cholesterol. So eating fat. I remember I got my cholesterol checked one time, and I'd eaten Italian sausage on the grill the night before, and we did it in my lab in Vermont, and I watched them spin it down, and the serum, which normally is a clear straw color, was just pure white.
Oh, geez.
And I said, go ahead and send that in. It'll be fun. I want to see what it is, because my triglycerides are normally normal. It was like, 1,100 or something, some crazy high number. And that actually, some damn insurance company got a hold of that and doubled my insurance rates for a couple of years. Yeah. So be careful playing with your lab work. But high triglycerides, lowering the amount of actual trans fats that you're eating will really help a lot. And so anyway, what can you do about it? So Dr. Scott, you want to talk about what you would do for somebody like that? I would just tell them, get their blood sugar under control, eat a healthy diet, and exercise. What do you get?
Exactly the same things. In addition to, there are some herbal supplements that can help with fatty livers. One of them is goji berry, which has been shown to help some with fatty livers. Of course, astragalus is always a good one. But believe it or not, it's actually pretty good. I can't. It's hard for me to even say that with a straight face.
I know.
Resveratrol is full of antioxidants. It can be really good.
And where do they find that?
In any
wine.
kind of health, in red wine. Yeah, in a lot of foods with. I personally take resveratrol as a supplement just so I can get enough.
Okay.
And then of course green tea.
What do you think about milk thistle for this?
Milk thistle's been shown to help some too with liver health.
I think that's
pretty
reasonable.
healthy, yeah.
So
and these things are all pretty safe. as long as you're not allergic to them. And
talk to your primary
somebody,
care.
yeah.
Don't do it because we said it. Look, do some research and see
Or
what's
somebody
going to
has
work
some
for
knowledge
you.
about herbal medicines, not just your
But
primary.
she did ask about if Dr. Scott had anything.
So I do, yes. So try those things.
A plant-based diet may help as well.
Yeah, right on.
So anyway, all right. Protect your liver. Drinking alcohol puts extra stress on your liver. Doesn't mean you can't ever have any, but avoiding it is typically advised for people with liver disease.
And have a good, clean penis.
Right. Yeah, okay.
That's right.
All right, Dr.
Avoid
Scott.
liver. Keep your penis clean.
Well, thanks to everybody. Check your stupid nuts for lumps. Quit smoking. Get off your asses. Get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. All right. Maniac.
We do have a question.
Okay, good.
And
do you want me to pin stuff?
No, I got this. There was only one major one.
Well, we had two. Oh, we did Chris
because-
Max, though. Right.
Yeah, right. And then,
So I'll
actually,
unpin
technically we got two. And Darth gave us a $2 tip.
Oh, thank you. Okay. What about Old Top? Is that the one?
Yeah, that's
you're
one.
looking at?
And then one just came in, which is going to be your specialty.
Okay. My elderly patient refuses to
Yep.
eat. Okay.
Yep.
Yep. Okay, I'll pin that to the top. Oh, you can only have one. That's bullshit.
Yeah, I tried to remove the. That's okay.
Okay.
Yeah, just leave that old top one up at the top, and then we'll do
I
the.
just took it off. Sorry.
That's okay. I've got it.
Okay.
I see it.
Yep. All right. And then I'll do the super chats real quick, and then we'll go into questions. How about
Let's
that?
go. Yeah, we got two questions.
All right.
Sausage.
All right, Dr. Scott and Tacey, we do have some super chats. Darth Nugs, thank you for the $2 super chat, my friend. Be sure to drink plenty of fluids today. Yes, fluids. Thank you.
Can you, shut up?
I hit the wrong button, Darth Nugs. I'm sorry. And Darth Nugs gifted 5 Weird Medicine with Dr. Steve memberships. They're only 99 cents. Myrtle was giving 20 away at a time for a while there, but she couldn't get her computer to boot up this morning. So, Chris Primer, thank you for the $5 super chat. He just says hello. Well, hello, Chris.
Well,
Thank
hello.
you. Bill Loney became a member of the Fluid family. Thank you, Bill. We like Bill. I like Bill a lot, as a matter of fact. I hope to see him at DabbleCon 2. I'm working on my roast. I said I'd never do another one again.
Oh no! Here we go.
Here we go.
But this,
I know, Scott.
This will be absolutely the last one. No. I'm telling you, it's probably going to be my last live event. So, for real.
He's calling it his swan song.
Well, it is a swan song. So, it's probably going to be my last live event. I'm getting too old for this shit. The stress. I'll still go and be a fan, but I don't think I'm going to perform anymore after this. I really enjoy doing the things like I'm doing for Normal World, where I can sit in front of my green screen. If I start hacking and coughing because of my stupid COVID-related bronchiectasis, I can just stop it and edit it out, and I can. And those things, they're more concise. I am. Concise in real. I am not concise in any way, and I get distracted easily, so I can edit all that shit out, and I'm a lot funnier when I'm writing than I am when I'm just sitting here talking and trying to come up with stuff. So I think I'm going to go more toward the produced video things, and I'll contribute stuff like that for Carl's live shows. He's been kind enough to run some of those, and they've gotten really good reactions, and the grosser the better. So we'll continue to do those. So that's kind of where I'm going with that. But anyway, so he asked me, I agreed, this is absolutely the last time. If I do it ever again, you have my permission to do something horrible to me. I don't know, chop my nuts off or something. I will not do it again. But I want this one to be good, so I've already started writing. It's 6 weeks away, and I'm already writing and I'm already getting nervous about it.
Cool.
Anyway, looks like someone else gave, let's see. Oh, Darth Nugs gifted another 10 Weird Medicine with Dr. Steve memberships. Thank you, Darth Nugs. I'm good. Actually, I'll give him
Give
a bell.
myself a bell.
And Dr. Scott.
Get your hand off my penis!
I always have to run that one every time because Dr. Scott's got a problem. But thank you, my friend. Thank you very much. And if you want to receive a membership, you have to go to our website at youtube.com/@weirdmedicine and join the Fluid family. Subscribe and then click. But you don't have to join the channel. You're joining the Fluid family by just subscribing to the channel. Just click join and don't pay any money unless you want to. And then just click the button that says accept gifted memberships. And even if you're not there, if you're a subscriber, let's say there's only 3 people in the chat, which is impossible at any one time, because we don't really push this, but we enjoy having the audience that we have, and we really appreciate them. Let's say there's only 3 people in there, but somebody gives 10 memberships. The other 7 will be given to random subscribers. So you can get it even if you're not there, so you don't have to be there. All right? All right. Now, Dr. Scott, what else you got?
I got a couple questions from the Fluid family today.
All right.
The first one would be from Old Top. Hey, Dr. Scott and Dr. Steve, what are some causes of heat intolerance? I know that UV exposure can trigger autoimmune disorders or disease, but can heat also trigger even though you're wearing UV protection?
Oh, yeah. The
Yeah.
UV protection keeps you from getting burned. It doesn't.
Keep you from overheating.
UV doesn't make you hot. The infrared waves coming from the sun is what transmits heat.
Mm-hmm.
So, you can still get hot even when you're doing that. And the number one cause of heat intolerance is, Tacey, you know the answer to this.
No, I don't.
Oh, okay. You do. Thyroid disease.
Oh, so is that why I get so hot?
Well, only when you're taking too much of your
thyroid medicine.
Too much of your thyroid medicine. It tends to be people who have an overactive thyroid will have heat intolerance, whereas people with hypothyroidism will have cold intolerance.
And the other one, as far as autoimmune disorders, think about lupus. So SLE people are really sensitive to the sunlight.
Yeah,
and
multiple
heat, so.
sclerosis,
MS, yeah.
overweight because they can't radiate out enough heat. You only have a certain amount of surface area, and if you've got a lot of mass, it's hard to get rid of all that heat. Diabetes, high blood pressure, lower levels of physical fitness, that kind of stuff.
Right.
But yeah, sunscreen will not prevent you from getting hot.
No.
Now, there are medications that cause heat intolerance as well. And number one is amphetamines, which people aren't doing as much street amphetamine like speed. You don't hear about it as much anymore.
Right.
But they're taking a whole lot of Focalin and Adderall and Concerta and stuff like that. And those things can cause heat intolerance. Caffeine can do it.
And some antibiotics, correct?
Correct.
Some antibiotics make
and
you more sensitive.
antidepressants.
Yeah, okay.
Antipsychotics.
I know.
That kind of stuff.
All the good stuff.
Overactive bladder medications, because they are anticholinergic, and it makes those people sweat less.
Yep.
So there you go.
Ooh, I need that.
No. Well, you've been on them before.
Yeah.
I have not.
Yeah. Yeah, you did. You took, anyway, you took medications for those things.
She's tried them all once. Hey, listen, another question from WTF, get over it. Good morning.
Good morning.
My elderly parent refuses to eat. What can I do to so their appetite can increase?
Yeah.
They only eat once a day and very little.
Okay.
So that's a pretty good question.
It's a very good question. I deal with this every day in my practice.
Yep.
There is one thing. For thousands and thousands and thousands of years, the way we left this world was we took to our bed and we stopped eating and drinking.
Right.
Now, we have technology now in the last 50 to 100 years to put tubes in people's stomachs and put food in their stomach when they're not asking for it.
Right.
But that's not what they're asking about. They're asking, how can I stimulate someone's appetite? You may or may not be able to do this, but there are some. Dr. Scott, you want to talk about the number one that we use now?
Well, yeah, it's THC,
Correct.
CBD.
Yeah.
Increases your munchies.
Yeah. So
Desirable
it is
munchies.
sold in all 50 states as dronabinol.
Yep.
The problem is there is a shortage of dronabinol in the and the reason it's FDA approved is because it's synthesized in the lab. It's just delta 9 THC synthesized in a beaker and then put into pills. And that's why the FDA could approve it, because it has a standardized strength and a standardized concentration inside the pill, and it comes in 2.5, 5, and 10, and those things are within certain tolerances. It boosts appetite in people with cancer, but also in people with anorexia due to HIV, AIDS. But also we've used it in the elderly. The problem is that it can increase confusion, dizziness, drowsiness, stuff like that. So you want to start at the lowest dose and see if they tolerate it okay. But there is a national shortage. If you live in a state where pot is legal, you may be able to go to the dispensary and ask them for pure THC, and I want 1.25 to 2.5 milligrams to start with.
Super low, yeah.
Yep. And but then there are other drugs. There's one called Megastrol or Megestrol acetate, and it's Megace is the brand name it's sold under.
Okay.
It's basically a progesterone-based medication, so it's hormonal, and you can use it for people with anorexia due to cancer, HIV, AIDS, that kind of stuff. The problem with it is that it can cause fluid overload, and there's a possibility of it causing blood clots. So if you've got a patient who is immobile, or I hesitate to use it in cancer patients sometimes because they can be hypercoagulable.
Sure.
There's an oral steroid called oxandrolone that helps people gain weight. Some people will abuse it to gain weight in the gym, but it can cause acne and, androgenate. What's the word I'm looking for? Not feminization, but androgen. Shoot, what is it? What is it when it makes you take on male characteristics?
Oh,
Some doctor,
androgenic.
Yeah, it's androgenic.
Something
Okay,
like that.
But that's not the word I'm thinking of.
Yeah.
I don't know. Anyway, as George Foreman said, as you get older, you lose your quickness, you don't lose your power. So I'm
there you go.
Take that. So the power is still there. The mental quickness, not so much. So anyway, and then there are some other medications. What we used to use, and this was my favorite thing back in the day before we had all these drugs, was a thing called elder tonic. And my patients say, well, do you have that elderly tonic? And what it was sherry with vitamins in it.
Okay.
And you would give them a tablespoon before meals, and they'd eat like crazy. It stimulated their appetite. So a little bit like an aperitif would do, and something that, a little alcohol that you take before you eat can stimulate your appetite. So if they're a teetotaler, or if they have a religious objection to drinking alcohol, or if they, they're sober because they had a problem, I wouldn't use that. But in the typical elderly person, a tablespoon of elder tonic sometimes will be very effective. I've had people come back saying that was the greatest stuff they ever used. And it's cheap. So there you go. All right, you got anything else?
No, but Nick did pipe in and hit us with a little love. Yep.
Yeah? Oh, is that right?
Yep.
Okay. Well, let me see.
Scroll up a little bit, you'll see it.
Oh, yeah, Nick Illig. Okay.
Yep.
Hey, Nick, we're going to be in your neighborhood. Hopefully this time your brother won't hog all of the attention. We can hang out with you as well. So his brother is Captain Mike Illig in Allendale, South Carolina. If you want to do a charter, if you're in Charleston area, and you want to do the greatest charter in the world, Captain Mike is a naturalist.
Oh, cool.
He even brought us chanterelle mushrooms one time.
Yeah.
And, he can teach you to catch your own bait if you want to, or you just go out and fish he knows where all the different kinds of fish are. Remember we went out and, where was it? We got mackerel out at the jetty that time. We took it in and had them cook it fresh.
That was nice.
It was amazing. We had a big redfish that we took.
Oh, geez.
His company is called Avid Angling.
Correct. Avid Angling. And you can find him on Facebook and the internet. But this is Captain Mike's brother, Nick. Thank you for the $5. I quit boozing. Wow.
Cool.
And have been drinking 20 sparkling waters a day. Could this be bad? Maybe too much acid. Happy 4th. Okay. Well, Nick, are you sure you're not drinking? It's actually the 7th or the 6th right now. But anyway, I'm glad. Hey, congrats on your sobriety. No kidding. And the problem with seltzer water is the carbon dioxide can leak calcium out of your bones and make them weaker over time.
And it can also add, and it makes SIBO a little worse. They've shown sometimes that extra
We'll tell them what
gas
SIBO is.
a small intestinal bacterial overgrowth syndrome. Yep. And it can actually be made worse with carbonated drinks. Believe it or not, the gases helps carry the SIBO down the colon further and spread them.
Nick, email me and I'll see if I can find a sort of LD50 for carbon dioxide drinks. And if you get some that have less carbon dioxide in them as well, that are sparkling but not carbonated, that might help. And then you're going to want to find some things that I'm assuming that he's drinking sparkling drinks because he was drinking beer.
Yeah.
And you want that feeling. But you might transition every other one instead of 20.
Or cut it.
You could cut down to 10, and then every other one drink something else.
Or cut each sparkling water with water, halfway through it.
Yeah.
Just add water to it.
Yeah.
Just
make
dilute
it even worse.
But
anyway.
All right, guys.
Tasting. But anyway, Nick, email me. You have my email, and I'll see if I can find some information on that for you. Okay? All right. I think that's it.
Thank you, guys.
Thank you. Thanks. Always go to Dr. Scott. Thanks, Tacey. Thanks to everyone who's made the show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website, drsteve.com, for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye,
Thanks,
everyone.
Goodbye. All right. And then, let's just do the opener. Now, I'm not going to... I'm giving up doing that fancy opener because, like I said, it took me 2 hours to get the AI to do everything and put it back and stick all the things in the right place here. So I'm just going to let it process. But what it will do is it'll take out the breathing sounds and the ums and the ahs, which I can only do that on the podcast side because it changes the length of the show, and I can't do that on the SiriusXM side. SiriusXM side. But we'll try it and see. I'd be very interested in people's thoughts if it's working. And as soon as it cools down outside, we'll get rid of it and go back to turning the air conditioner off. Okay. All right. You ready?
Yep.
All right. Here we go.
This is not how sane people act.
Scorn and defiance, slight regard, contempt.
I don't care. I don't care. My jokes don't go over. I don't care. Everybody, I don't care. I don't. He does not care.
Man, you are one pathetic loser.
I almost threw up that time.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my inflammation.
Sorry.
That's not good.
Technical mess up. Didn't record. All of that didn't record. Sorry.
Oh, great.
Yeah, sorry. All right. One mulligan. That's my mulligan.
This is not how sane people act.
Scorn and defiance, slight regard.
I don't care. I don't care. My jokes don't go over. I don't care. Everybody, I don't care. I don't. He does not care. I don't care.
I almost threw up that time.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve.
From the world-famous Cardiff Electric Network studios in beautiful downtown Tukey City, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. And, I don't know, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine practitioner who gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner, Tacey, and my partner in all things. Hello, Tacey.
Hello.
This is a show for people who never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine and at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Check out stuff.drsteve.com. That's stuff.drsteve.com for all of your shopping needs. You can scroll down, find the Rody robotic tuner, or you can just go to rody.drsteve.com. And you can also check out the Rody Coach. That's their new guitar trainer, and it will teach you how to play your instrument. So check that out. Rody, ROADIE.drsteve.com. Check out Dr. Scott's website at simplyherbals.net and patreon.com/weirdmedicine. So what's going to happen now is I got kind of fussed at by the network that we're on right now, which is Studio 71, and they just do our advertising, really, but we can't get on Google Podcasts, which is now YouTube Podcasts, because I have I put these shows up in their entirety on our YouTube channel. So I've got Andy Hines from A. Hines Media. Check him out, ahinesmedia.com, or you can find him on Twitter or Facebook, I think. Or email me if you can't find him. And he takes our shows and cuts them up and puts them on TikTok and YouTube Shorts and on YouTube. So what's going to be on our YouTube channel going forward, now we may get demonetized because of this, because we won't have as many views, but we'll see, is we're going to take this recording and put it on Patreon, and then we'll have the excerpts on the YouTube channel.
Okay.
And so he'll have longer form ones, 10 to 12-minute ones, and then the 2 to 3 minute ones when Tacey's running the timer. Those are perfect for those. So Tacey's idea had, we can repurpose her idea, which is constraining for us, but it's good.
It wasn't my idea.
Was it not? Oh, that's right. It was. It was a listener, wasn't it? Yeah. Mm-hmm. So when we're following that, then that makes it easy for Andy. But when we're not, not so much. But anyway, sometimes we just have to violate the 3-minute rule because it's important for somebody to hear something a little bit more expanded. But anyway, so those will be on our YouTube channel, and the long form, just the complete recording, which is where we just hang out with our friends Amanda and Darth Nugs and talk like I hick to you, and Tracy with an I, and other, Chris Mack and others, if I didn't mention you.
Old top.
Yeah, an old top. Old Rocky Top. He's a kid. Then we will, we'll put those over there and then have all this stuff up here. So, check out our Patreon, patreon.com/weirdmedicine. In addition, I'm putting the short form produced videos on Patreon, and it just basically anything that we produce is going on the Patreon, even if we don't put it somewhere else. And access to older stuff that is not available because we used to be a little less restrained back in the day. So on those I had to take off. The internet, everything before 300 doesn't exist, but you can find it on the Patreon if you want it. Anyway, and then cameo.com/weirdmedicine. And we need to do a cameo today, if I can find my phone, as soon as we quit here, because we've got one to do, okay? So we'll do them in the studio if you want, or I'll do them when I'm driving, or you can have Myrtle do them, whatever you'd like. Cameo.com/weirdmedicine. All right, let me save this one as, okay, and today's date is 0706.
Yes.
Yes, today's 0706 and broadcast 0713.
Are we done?
Yes, you are done.
You're good.
Well, unless you want to stay to do the cameo. If you don't mind staying just for a minute. Okay. Let me see what it is. I just got a notification this morning. And then we'll play some music. We'll have the Fluid family say hello. I wonder if I could do that. Okay, for Pony Power 2, I'd like some measurements on the finger you used on Rocco. I want to recreate it as a 3D print. Okay. Let's see here. The more detailed, the better. A close-up look might help as well. Oh, yeah, I'll do that. All right, here we go. And by the way, it was a simulated prostate exam. All right. At least that's the official line. All right, here we go. Hey, Pony Power, it's your old pal, Dr. Steve. And I understand you want some measurements on the finger I used on Rocco. I want to recreate it as a 3D print. Here it is. I can tell you from this knuckle, well, from the knuckle there to the tip of the finger is 10 centimeters because I've measured it because I use this as a measuring tool. So that is 5 centimeters and this is 2.5 centimeters. So that is 10 centimeters. So I'll get you a good image and I'll rotate it for you. Now, if you're coming to DabbleCon, I definitely want one of these. And I can't rotate it the other way. So there you go. Hopefully you can create a 3D construct from that. Let me do it against a neutral background. I don't know if I can with this, but I could send you a video. Shit. There you go. All right. Now, don't be copying my fingerprint so you can get into my phone. All right. And everybody's here. Dr. Scott wants to say hello.
What's up?
And Tacey's saying hello.
Howdy.
We just finished the show, and the Fluid family is saying hello. There they are. Excellent. All right, my friend. I hope that helps. Thanks. It's hilarious. And thanks for listening. And I really appreciate you. And I hope you have a great weekend filled with fluids and secretions untainted by human pathogens. Take care. All right. Now you can go to it.
Pony Power is your old pal, Doctor.
All right. And he wanted that one to be private. That's too bad. All right. You want to play some music, Dr. Scott?
Let's do it.
All right. I'm in.
You want to...
Uh-oh. Spam.
Imagine that.
That's all I'm getting these days, but I have to answer because a lot of the nurses that call me, I don't have their numbers in there.
Oh, yeah,
So I have to answer every single one of them.
Man, that's a bummer.
But that one said spam, so my spam filter caught it.
You know we hadn't played in forever?
What?
Going back to Willie Nelson.
Yeah.
You
are always on my mind.
No, we can't do that one. We're gonna do All of Me.
Oh yeah.
Because
oh shit. Well, you know that's a hard one on the bass. I have to practice that, but I'll do the best I can.
Yeah. Well, I'll carry the rhythm because remember you got to whistle the in between part.
Oh yeah. Okay, where do I find that?
So let's do. It's Willie Nelson. Make sure you do Willie Nelson first.
Okay.
Willie Nelson, All of Me, number 709.
That's under Ultimate Guitar.
Yep.
Now, I would like to do this song when I've practiced it because there's a really good bass line.
Oh, it's a great bass line.
Fun to do, kind of a swing jazz bass line.
Exactly, yep.
Okay, so Willie Nelson. Is his version different?
Yeah, I didn't know this, but I guess John Legend does a version of
Oh, okay.
I'm sure it's good, but I've just never heard it.
People watching me type, I do know how to type. It's just like I need both hands. Okay, I've got nothing Willie Nelson, All of Me. Maybe I just have to do Willie Nelson. Okay, there we go. I swear I don't see anything that says All of Me, so I'm going to do All of Me.
Yeah. Or maybe All of Me and then put Willie Nelson.
Ah, there we go. $709?
Yep.
Okay. Hang on. You using Tacey's?
No, I plugged in since it's
you did.
I played the guitar on this one.
Let me hear it. No.
Nothing.
Here we go. I still think it's gonna be better on the mandolin, but
well, I'll play this one. We'll play the next one on mandolin.
I mean, I think this song would be better. On
you
the
do?
mandolin. I do. There's just something about the mandolin.
Yeah, okay, we can try it. Got it?
No.
Close?
No.
Here we go. 3. All of me, why take all of me? Can't you see I'm no good without you? Well, take my heart, I want to lose them. And take my lips, I'll never use them. Your goodbye left me without a cry. and I know I'm no good without you. You took the part of me that once was my heart, so why not take all of me? All of me, why not take all of me? Can't you see I'm no good without you? But take my heart, 'cause I want to lose it. But take my lips, I'll never ever use it. Your goodbye left me with eyes that cry, and I know I'm no good without you. You took the heart of me that once was my heart, so why not take all of me? Why not take all of me? Could you do it again?
I can't do it when my lips are dry. I need to drink some.
That's like the longest whistling part ever.
Can we do from where it does the C? I'm having trouble there. I'm not doing that right.
Yeah, you
so
want
it's
to go
C,
yeah.
C minor 7,
C,
G major 7, E.
C, C minor 7. So we'll just go up. So you took the part of me that once was my heart, so why not take all of me?
Oh, I see. Okay, so it's the B. The B7 is just an accent note. So
yeah.
Why don't take all?
So why not take all? So yeah, if it's the very end, the very end is a little different than the song is a little bit different than the first half.
Oh, okay.
So it does go. It goes C minor 7.
Okay, let's do the first one, and then we'll do the second one.
Okay. So let's just go to the
You took
the part of me that once my heart, so why not take all of me? And then the transition, and then if you
right, that one I got. Yeah. Okay, now let's do the one at the end.
Yeah. So and that's you just go back. You just do the C second time instead of going on to.
Yeah, but it goes C D E 7 though.
Yeah. Yeah. So let's do the C major 7 first.
Right.
So you took the part of me that once was my heart, so why not take all of me? Why not take all of me? Yeah. Let's see it one more time because that is a little hard. That B7 is just a real quick, just to lead into that E7.
Okay.
Yep. So let's go back to the C.
Okay.
3, 2, 1, and you took the part of me that once was my heart. So why not take hold of me? Why not take hold of me?
Okay, let's do it one more time.
Yeah, because
I wasn't hitting the B7, but I think I actually need to hit it. So.
Yeah, I think it does. I think it's important. Yeah.
2, 3, 4.
You took the part of me that once was my heart, so why not take hold of me? Oh shit! Why not take hold of me? Why? I fucked that up terrible. One more time. God damn, sorry.
Do we hit the B7 or do we not?
Yeah, we do. Yeah, and
let's do that. Why not take
on? Yeah, let's go back. But let's start with the you. Yeah, you took the part of me because
So it's why not take all?
Take all of me.
Actually, the B7 should be on off.
Yeah. Why not take all of me?
Because it's a false cadence, is what
Okay.
it is. Okay, so you do the B7 on of. So you sing it. You just sing it. Just sing it normal with it. Don't play it. And let me play it. So just sing it.
So why not take all of me? Why not take all of me? Oh, that swing sounds good.
Okay.
Yep. Let's try.
So
the
you got to do the B7 on the word of.
Okay, I got you.
Okay,
So let's
ready?
go back to you took. 3, 2, 1, and you took the part of me that once was my heart. So why not take all of me? Why not take all of me?
Okay, instead we fucked it up again.
Yeah. That's tough.
So what? C, 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 D.
Yeah. Let me go just a hair slower. Yeah. Let me go just a
me
hair
should
slower.
be the E7.
Yeah. Oh yeah. Totally.
C, 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 D, B, E7.
I've just got to get my finger, just the finger work on it.
I wonder if you could skip the B and just let me do it, and you just go to the E7.
Good.
C,
Yeah.
C, C, D.
So you took the part of me that once was my heart. So why not take all of me? Yeah. Why not take all of me?
Okay.
Yeah, I think. Yeah, I
just don't hit the B sound. Let me do it.
It's just so quick. Yeah, it's easier if I don't play because then it sounds better.
All right, you want to do the last verse
Screw
then?
it up. Yeah, let's
And
see
then
the
we'll
last.
get out of here?
Yeah, let's see the last verse.
Okay, that's a good one. And we need to practice this and do it good.
I love. Yeah, it's just a great.
We keep saying that.
You start swinging there a little bit. Boom.
Okay.
All of me. Why not take all of me? Can't you see I'm no good without you? Well, take my arms, I want to lose them. Well, take my lips, I'll never ever use them. Your goodbye left me with eyes that cry, and I know I'm no good without you. You took the part of me that once was my heart, so why not take all of me? Why not take all of me?
I got to lube up my lips before I can whistle. For real.
All right, let's get out of here.
Some chapstick and some water.
Yes, you need to.
And hit the notes right, too.
You need to. It's hard to whistle and play it down. It's easy if you're strumming.
Now I can do it fine.
It's easier if you're strumming. All right, boys and girls, ladies and gentlemen. Until next week.